Benzodiazepines and Pregnancy. Video created by Dr. O, Institute of Alcohol and Drug Psychoeducation. Benzodiazepines readily cross the placenta, and their use during pregnancy carries potential risks for both the mother and the developing fetus. The specific risks and their likelihood can vary depending on the type of benzodiazepine, the dosage, the timing of use during pregnancy, especially the trimester, and other individual factors. Here's a summary of the key considerations regarding benzodiazepines and pregnancy. Potential risks to the fetus and newborn. Congenital malformations. While earlier studies suggested a link between benzodiazepine use, particularly in the first trimester, and an increased risk of cleft lip and palate or cardiac malformations, more recent and larger studies have shown inconsistent or no significant increase in the overall risk of major congenital malformations at typical doses. However, some studies have indicated a slightly elevated risk of heart defects with higher doses. Neonatal abstinence syndrome, NAS, withdrawal. Use of benzodiazepines, especially in the third trimester or near delivery, can lead to the baby experiencing withdrawal symptoms after birth. These symptoms can include irritability, tremors, restlessness, sleep disturbances, poor feeding, and in severe cases, seizures. Neonatal sedation and floppy baby syndrome. Benzodiazepines can cause sedation, decreased muscle tone, hypotonia or floppy baby syndrome, and breathing difficulties in newborns, particularly if taken close to delivery. This can sometimes necessitate admission to the neonatal intensive care unit, NICU. Low birth weight and preterm birth. Some studies have associated benzodiazepine use during pregnancy with an increased risk of low birth weight and preterm birth. Spontaneous abortion, miscarriage. There is some evidence suggesting a possible increased risk of spontaneous abortion, particularly with benzodiazepine use in the first trimester. Neurodevelopmental effects. Long-term effects on neurodevelopment are not well understood and require further research. Some earlier data suggested possible delays in early development, but most children seem to catch up. Potential risks to the mother. Dependence and withdrawal. Benzodiazepines can lead to physical dependence, and abrupt discontinuation during pregnancy can cause withdrawal symptoms in the mother, which could also potentially affect the pregnancy. Tapering off benzodiazepines slowly under medical supervision is recommended. Increased risk of cesarean delivery. One study indicated a higher likelihood of cesarean delivery in pregnancies with maternal benzodiazepine use. Important considerations. Severity of the underlying condition. It's crucial to consider the mother's underlying condition, e.g., anxiety disorder, insomnia. Untreated severe anxiety or other conditions can also pose risks to both the mother and the baby. Risk-benefit assessment. The decision to use benzodiazepines during pregnancy requires a careful assessment of the potential benefits for the mother against the possible risks to the fetus. This decision should be made in consultation with a healthcare provider experienced in managing psychiatric conditions during pregnancy. Lowest effective dose and shortest duration. If benzodiazepine use is deemed necessary, the lowest effective dose for the shortest possible duration is generally recommended. Alternative treatments. Exploring safer alternatives, such as certain antidepressants or non-pharmacological therapies, is often recommended, especially during the first and third trimesters. Tapering. If a woman is taking benzodiazepines and becomes pregnant, she should not stop taking them abruptly. Gradual tapering under medical supervision is essential to minimize withdrawal risks. Thank you. Source: Gemini AI.